Hi, I'm Natasha Helfer, and this is the Healing Souls podcast. Welcome to the show. And tonight I am so excited to have my dear friend and colleague, Dr. Stephanie Beuhler, with us for really kind of a part 3, although it's been a long time since we talked about parts 1 and 2.
Like 9 months?
Been longer than 9 months. I think we've been able to have 2 or 3 babies by now. But we are here to talk about sex after babies, after pregnancy. But let me introduce you formally first, because you deserve a great introduction. So Dr. Beuhler is a licensed psychologist. She's an ASECT certified sex therapist. ASECT stands for American Association for Sexual Educators, Counselors, and Therapists. And they are the only national organization that I'm aware of that certifies sex therapy, which is kind of a big deal. And they make a big deal about it. It takes a long time to become a sex therapist. So Dr. Beuhler has over 20 years of experience. She's helped men, women, couples with all kinds of sexual issues. She's a graduate of UCLA, USC, Pepperdine, and CSPP San Diego. You specialize in helping people with sexual problems, specifically with cancer and chronic illness, as well as painful intercourse, infertility, and postpartum sexuality. So she is the author of several books. One that is What Every Mental Health Professional Needs to Know About Sex. And I think every mental health professional should have that book. But one of her other books is called Counseling Couples Before, During, and After Pregnancy, which is not something that is written much about, as you well know. That's why you wrote the book. So she's an in-demand speaker, has given talks all over the place, both at professional and lay audiences. She's been quoted in The Atlantic, WebMD, Prevention, OC Magazine, Los Angeles Times, Men's Health, HuffPo, and more. So she's just generally phenomenal. So I have the privilege of teaching with her at her institute where she teaches sex therapy. It's called, if you want to know more about becoming a sex therapist, you can go to learnsextherapy.com. Anything I missed?
No. Wow, what an introduction. Thank you. Thank you. And you know, we have a mutual admiration club going. I've watched you grow, from you were already a very skilled and competent therapist when we met, but to see you grow into this field, and now you're a supervisor and teaching with me. And doing things like this podcast. I know you do much more. It's all awesome.
It is awesome. And yes, you were my supervisor as I was becoming a sex therapist. That's how we met. So we've been connected now for about a decade that we've known each other. Wow. So that's kind of hard to believe, but very cool. So so we're here to talk about sex and babies. You know, you'd think that those two things would go together better than they do. But a lot of times babies are interrupting a lot of sex.
Yes. Yes, babies have a way of doing that.
That's right. That's right. So we are here to talk about that. So I guess, first of all, why don't you just talk a little bit about how you came to write this book and what made you interested in the topic?
Right. You know, it's funny because as I was kind of preparing for doing this tonight, I realized that a long time ago, maybe 20 years ago, I helped write an article about postpartum pregnancy for a sexual health newsletter. This is, sexual health was just kind of coming into being. And I think it was actually Beverly Whipple and somebody else. Beverly Whipple, for those who don't know, is the woman who wrote the book about the G-spot.
Yay!
Yay! So she wrote
no G-spot, but yay for the
Yay! I know, but at least she wrote the book, right? So she wrote the book about it. And I remember helping to write this article and interviewing somebody about it and thinking what a fascinating topic. But the other piece is that most recently, I was working in an office that was on the same floor as a couple of very large obstetric clinics. And so when I would get on and off the elevator, there would be like, it was like a clown car filled with pregnant women. And I'm doing, sex therapy all the time. And I just found myself going, wow, couples so often say that their sex life just went off the rails after they had children. And I went, well, you know what? I want to know more what's going on about sexuality before the pregnancy and then during the pregnancy. And, I think most of us have a kind of an idea what happens after the pregnancy. I might be able to tune people into a few things that they don't know. But it was very fascinating to write the book and really get a better picture of what was going on, why people would say, having babies just like put a put a knife into the sex life. So it's very
Right.
sad. It is. It's sad because, we think
Right.
babies are wonderful and they are wonderful. But while it takes sex to get a baby for the most part, it's not, yeah, they're not very sexy.
Right. 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 Well, so let's just start right off the bat, and I'll make sure and link to the other two podcasts that we did, because we did do one on, sex before pregnancy and or sex, I guess, during pregnancy, and then sex before pregnancy, and now we're at sex after pregnancy. So let's talk a little bit about, right off the bat, I think what happens is you do get kind of a prescribed break from sex, which we typically define as penis and vagina heteronormative sexuality. And it's
Yes.
like, no, none of that for 6 to 8 weeks, depending on what your experience has been, delivering. So what are some of the things that right off the bat happen that you're aware of that start kind of this sense of our sexuality is on the back burner?
Right. Well, I think the very first thing is that we're told, at 6 weeks, you can have intercourse. And, first of all, that's only tied to what is going on physically with the cervix. Because after you give birth, the cervix has to close back up and keep the environment appropriate for the uterus as it is healing. And your uterus, of course, is shrinking back down, hopefully to where it used to be. And so many couples, I'm going to say couples, because I think we have the stereotype that the guy, if we're talking about heterosexual couples, that the guy is like waiting there. It's like he's waiting for a meal with a knife and fork and a napkin tied, like he's dying to have sex. And the woman is like, what? And I think often both people are not really ready to start having intercourse. They're tired, they're distracted, the baby's going to interrupt them, or they're afraid the baby's going to interrupt them. The woman's really not back to feeling good about herself. A lot of women are still struggling with body image. I don't know about you don't have to comment, but I mean, at 6 weeks, I was still like wearing my maternity jeans. I mean, like what the heck? Really? So, you're not looking your best, you're not feeling your best. And, it would be so much better if doctors said something more to the effect of, you could have intercourse, but of course, if you're not ready yet, that's perfectly fine. You can have sex in other ways. You could masturbate. You could have mutual masturbation. You could use toys. You could have oral sex if you're not yet ready for intercourse. But for some reason, that's too much information. So that's problem. I
Really
know, right?
problematic. Even non-sexual connection, like we'd really encourage you to cuddle and have physical contact with one another without the pressure of sex, or just be able to connect because this baby is
Right.
taking so much of your energy. Just
Right.
normalize,
Just-
right? Normalize
right.
the experience.
Bring your partner a cup of cocoa and give them a kiss on the top of their head and
Right,
say, wow, this is a lot.
right.
And just hold each other and be in that like kind of overwhelm especially with a first baby, that overwhelm that people have, just being like a tornado going through your life, right? And not knowing which end is up. I think it would bring a lot of couples closer. There's so much going on psychologically and emotionally as we make that transition from being, just like an independent person. Maybe your wife, maybe your husband, maybe you're just partners living together. It might be a lesbian couple too, but you're two independent people, and now you're united through this little person, and you've become parents. And it's just it's stressful. It's wonderful and
Yeah.
stressful. As we know, good things can be very stressful too.
Right. 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 Well, especially in this day and age where there seems to be quite a bit of pressure. I mean, maybe this was always the case no matter what age you were in, but it just seems to be a lot of pressure on how to be a parent the right way, and whether or not you're making decisions about, co-sleeping or binkies or no binkies or breastfeeding or no breastfeeding, or, there's just a lot of opinions and a lot of information out there that can be stressful in of itself, just in how to be the right kind of parent.
Oh, yes. And I think that contributes to another issue that comes up for about 10 to 15% of women, which is postpartum depression. That's a lot of women who have postpartum depression. And one of the reasons is that they have expectations of themselves and also of the baby. That the baby's going to, I think for some women, they think the baby's going to be more responsive at the beginning. Often the baby's sleeping, like, during the day, you're not really interacting. You're just sitting there with this like little being, you know, they're not smiling yet. They're just pooping and eating. And so, there can be some disappointment there. There's a lot of pressure, to be a good mother, to be a perfect mother. And the idea of being a good enough mother has kind of gone out the window. I don't know where all the pressure comes from. To me, a lot of it seems to come from celebrities. We see them portrayed, first of all, we see them pregnant with a baby bump, and then we see them instantly 30 pounds slimmer.
Mhm, mhm.
you
Back to
know
their pre-baby weight.
yes, right. Kate
Mhm,
Middleton back in her sheath dress after
mhm.
she gave birth. Like, really? And then they really look like fit and awake, and you don't really hear about the reality of what it's like to have an infant. And so that does lead to some depression. Of course, women are more prone to depression than are men anyway. We're at risk for a number of different reasons, biological as well as social. The hormones are all, getting back on track in some kind of way. It can take up to a year for the body to really recover from what one gynecologist said is really a trauma for a woman's body. So we have this expectation, 6 weeks. 6 weeks is like nothing
Mhm.
compared to the year that it takes for a woman to really feel more or less like herself.
Right. And
Mhm.
that can be also affected by the decision to breastfeed. I know that if you're breastfeeding, that keeps your hormonal state in a certain process that would be different if you're not. I know
Right.
for me, for example, when I was breastfeeding, this isn't typical. I mean, we all are different. However, for me, my sex drive went like not out the window, it went like into the next state while I was breastfeeding. And it was really shocking to me because I'd always enjoyed a fairly, I think what I would say common or high sex drive. And to have it be that dramatically different was a big, like I noticed, obviously.
Right. Yeah. Oh, yeah. Yeah. A lot of women, because of the book, I've had so many women come in to see me postpartum. And, one of the questions I always ask is, are you breastfeeding? Now, for some women, it doesn't seem to make any difference, but for some women, it does. And I don't know why women don't know that it can affect your drive. Maybe because there's a lot of emphasis put on health benefits, and people are afraid if they talk about your sex drive going into the next state, that a lot of women will opt not to breastfeed.
Right. I'm probably not helping in that in that. Well,
Right?
yeah, right.
But it's the reality, and it is something that I think couples sometimes may want to factor in. I have had women make decisions that maybe they were thinking in terms of breastfeeding for 2 years, but when they, and I always send them to the physician because, I'm a psychologist, so I can't tell them exactly what's going on with their bodies. But I do say, go back to your gynecologist and talk to them about your hormonal status and the effect on your drive. And that way they have information, they can make a decision about how long they want to continue breastfeeding, kind of weighing those benefits and detriments, if you will, and how important it is. And every woman, and really it's a couple's decision in a way, but for every woman it's going to be different. Some are going to be, well, I'll figure it out. If this is the way it's going to be, my drive is going to be low while I breastfeed, so be it. And I'll cope some other way, which often means, schedule sex and I'll show up and try to be present and, have it be enjoyable. We can talk about like ways to make intentional sex enjoyable. But for other women, they have made a decision, I'm going to stop at a year, or I was planning to stop at a year and a half, and now I'm going to stop at a year, something like that. So it does affect people.
Right. And right away, you're getting into one of the very common dilemmas that I think a lot of women face with this perfectionism of being the right type of mother, where if it's the kids' needs versus your needs, it's very difficult sometimes for women to know that it's okay to choose their own needs.
Yes,
And that actually, in the long run, that might actually help the kid, because kids don't do well when we're depressed and upset and sad and
right,
overwhelmed.
right, right,
Even if we're doing it in I guess in the kid's best interest.
right. And a lot of women really get pressured. I've had women say they were pressured by their in-laws or their spouse or friends, and they're actually their own mother, and they're really afraid that they're going to be dire emotional consequences if they choose not to breastfeed or choose to stop breastfeeding early. And the fact is there are some small benefits to breastfeeding, but again, it's a woman's choice. It's a woman's body, okay?
Mhm.
And she gets to decide on balance what's the best thing for her.
Yeah, yeah. Well, I figure that, if my body is feeding one child, there's probably some hormonal things going on in there that is probably not super excited about a possible second child coming along.
Well,
I'm guessing that's the
yes, that's
basis of this, maybe the science behind why this drive thing might be happening.
right. Well, there are women, and I have been told also that they were afraid to have sex because they were afraid they would get pregnant again. So they're breastfeeding, they're not using the contraception that they were using before they became pregnant. They're confused about what they should do. They're using breastfeeding as birth control, which is a terrible idea. Cannot tell you how many women I've spoken to who had, one baby 10 months after giving birth to the first, because again, it's kind of almost like old wives' tales that you can't get pregnant while you're breastfeeding. That's not true. So there can be a fear around that, however. And so, talking with a gynecologist about using appropriate birth control, and even condoms, if used properly and consistently, provide good birth control. Now, there are ways, and you don't have to have intercourse. We have this like penis vagina centric culture that we're in.
Mhm.
And I remind couples that you can avoid pregnancy if you don't have intercourse. So,
Exactly right. There's lots of outer course, wonderful ways to enjoy your sexuality, and
absolutely.
actually can be quite a bit more effective for female orgasm anyway. So
Yes.
that's lots of good benefits in that regard. Let's go back a little bit to, I probably jumped right into breastfeeding, but let's go back to that initial birthing process. and the types of births that happen. I mean, obviously there's, vaginal birth, there's C-section birth, and maybe some of the implications that can occur for people's sexuality long term.
Right. So that's kind of an interesting one. So one of the things, of course, it would be nice if every baby just slid into the world.
Sliding would be nice.
Sliding would be nice. I am surprised. I'm shocked sometimes. I watch a birth, let's say on TV. I've never watched one live in person, but how easily it all happens sometimes for some women. I'm like, really? And then there was me. It took like hours. I ended up with a C-section. But certainly, having an episiotomy or any kind of physical trauma during birth, or if there's been they using forceps, which isn't very common anymore, but it still happens sometimes, using forceps to help with the birth. All of those things do carry with it a risk of causing painful intercourse. But then just the fact of carrying the fetus around for 9 months and labor can contribute to having pelvic pain, and that can cause painful intercourse as well. And that is why women with a C-section can sometimes end up with pelvic pain. It can be from the incision itself, and if there's any scarring as that incision is healing from the surgery, but it can also be because the woman has spent quite a bit of time laboring. And so those pelvic floor muscles get stretched, and the ligaments and tendons are getting stretched as she's going through labor. So a large number of women at 3 months postpartum, something like 25% of women have painful intercourse. And, for some women that eventually just goes away. For other women, they're going to need some kind of assistance to get that figured out. And sometimes that means, well, of course, it means talking to the gynecologist, and it may mean seeing a pelvic floor physical therapist to get some help relaxing those pelvic floor muscles.
Yeah, this was something, again, personally, I can share lots of personal experience. I've had 4 kids.
I know, right? 4 babies.
So,
I had 1.
Oh man. Yeah. So after my first birth was a C-section, and they still gave you the 6 weeks type of thing. And I was one of those I was kind of excited to, get back into the groove. So I was like, okay, 6 weeks, let's go. And then the searing pain that I think shocked both me and my husband, right? At the time, like I've never experienced painful sex before. Thank goodness. I mean, lots of people do, prior to pregnancy, but you're talking about painful sex after pregnancy that a lot of people don't necessarily expect, especially if that hasn't been their experience. So that was me. And I was shocked. I was like, I thought my vagina was just fine. Like nothing went through my vagina. This is vaginal experiences I'd like to be having. What's wrong with my vagina, right? And so I think that was really surprising. I think there was nothing more telling to me about how little I knew about my own body than going through pregnancy. And at some level that made me really upset, right? Like here I am, a college educated, master's level educated person, a therapist, and yet I'm being surprised about things that are happening to my nipples and to my vagina and to my abdomen and to my uterus and all these things I just did not know. I did not know I would have cramps for days on end with my uterus contracting back to its normal size, right? I thought once you're done with labor, you're kind of done. Nope.
No.
I had painful contractions, right, for almost several weeks, I think.
Right? And wearing sanitary pads for weeks. And, if anybody is out there thinking about having a baby, we don't mean to scare you. But it's better to have the information. And
we don't need to be a form of birth control.
I know, right? I just realized, like, if I were listening to me before I had a baby,
maybe this is why nobody tells us anything.
Maybe.
If we tell them, they won't do it.
Right? It has to be a fairy tale. Well, maybe that's why women get disappointed, though, So there's like a whole thing here, really.
Mhm.
But so, like you, a lot of women are very surprised. They're not prepared, or they've heard maybe from a friend, oh, it hurt to have intercourse after giving birth. And I've had women say, oh, we still haven't tried. And, it's 5 or 6 months later. It's a big difference, big jump from 6 weeks to 6 months. And so, why is that? Oh, I'm just so afraid it's going to hurt. A lot of that's where we have a conversation about, well, how much time do you spend in foreplay? At which point they say, foreplay?
Right. Like arousal is so important, especially post pregnancy when your body is healing and needing that extra, extra engorgement, extra lubrication, all of those things that will help bring blood flow to all of those areas which need it,
Right?
Mhm.
Definitely. So, talking about spending 15 to 20 minutes of foreplay before you try, and using, hello, a lubricant, so that,
Mhm.
you have to use a little grease to get the job done.
That's right. That's right. I'm
So,
gonna have Dr. Christine King, who I actually know because of you as well. She's a pelvic floor therapist. She's going to be on the show in a few weeks. But
oh,
can you talk?
awesome.
Yeah, can you talk a little bit about what pelvic floor therapy is? I don't know that many people even know that that's a field or what it entails.
Right. And that's so interesting, because I've had a lot of women say that to me recently, that they didn't even know this kind of specialty existed. So a pelvic floor physical therapist, that's what they're specialized in treating. The pelvic floor muscles they're very strong muscles, and they're like a basket that they hold up all your internal organs, and they're doing a lot of work. They wrap around the entrance to the vagina, the urethra, and the anus, and they're responsible for maintaining tone of those orifices, those openings. And so if those pelvic floor muscles are too tight, you'll feel it. Pelvic pain is horrible, but you'll feel like all this tightness and cramping in your abdomen. If they're too loose, then you can have incontinence. When you sneeze, it's not just like a drop comes out, but like, you're really having like a flow of urine. So what the pelvic floor physical therapist does is, when a woman complains of either pelvic floor muscles that are too tight, then they will teach the woman how to voluntarily relax them. Because they're internal, they're muscles that are difficult to relax on your own. These muscles, when they go up here, you kind of know, like, okay, if I pull my shoulders down away from my ears and maybe have somebody rub, I'll be fine. But the pelvic floor muscles are a thing unto themselves. And then, of course, if the pelvic floor muscles are too loose, then they'll help the woman learn how to tighten them up and have appropriate tone. So
Right.
that is what they do. And they help with a lot of different conditions that women have, all kinds of sexual pain disorders, but also things like what they call chronic UTI, interstitial cystitis, and incontinence. I mean, things that I don't treat at all. And,
Yeah, right. Well, it's
you
a
know,
hands-on approach, right? So it's like going to the doctor. So they are hands-on and they can manipulate and explore and, diagnose some of these issues. And by feeling, in your vaginal areas, they can feel the muscles and they can kind of
right?
tell what is happening, where things are tight or off kilter or things like that. So it's a really fascinating field and
It is.
fairly new, which is, good that we have more resources as females, because in the past it's been a lot of times it's like, oh, it's just all in your head, or have a glass of wine, or it's like,
Yes, right.
no,
No,
no.
there's something really going on,
Yeah,
and, needing to have a specialist who can really
yeah,
help you have appropriate muscle tone and be comfortable and function the way that you're supposed to.
right. One of the things that I heard you say the last time you presented is that, and this is maybe for another topic, but it kind of plays a role here, in that if you had severe trauma or like an episiotomy that went really poorly or things like that, when you hit menopause, those wounds may have a bit of a comeback. Do you want to talk a little bit about that?
Yeah. So, my understanding, my understanding of what's going on physically is limited. But because, before menopause, your tissues are filled with estrogen, and so the labia and the area, the intritus, which is the skin that's around the entrance to the vagina, all has an appropriate amount of estrogen. So as you're going through menopause, your estrogen levels are decreasing, and those tissues aren't getting estrogen, so they're becoming thin and sometimes easily torn, or they can get micro tears in them. And so women sometimes find that sometimes they have to go in for like a reconstructive surgery or something of that nature. And or the pelvic floor PT can help with that scar tissue by doing massage. So that's kind of the physical piece. I've had women who have had maybe they had traumatic birth and ended up with a lot of scar tissue, and women who've had trauma, not with having to have a surgical revision of the scar and have it bring up old psychological trauma as well, and having to work through that. So that's very interesting. And for me, as a sex therapist, working alongside pelvic floor PTs has been very, very interesting. I'm not there at that clinic any longer, but I'm still seeing, I have PTs from all over the place referring to me
Right.
because, that specialty that I have.
Yeah, so that's a whole nother interesting possibility, is that prior trauma is triggered or remembered or brought back to kind of the different level of consciousness post baby, right?
Right,
So,
definitely. The thing is too, again, from a psychological standpoint, for women, while you're going through the pregnancy, you're being poked and prodded and having to lift up your shirt and spread your legs, and you're having somebody tell you to do these things, and it can be quite triggering. And then the birth experience can also be triggering of past trauma. So, and if there's anybody listening, or either therapist or anyone layperson listening, and you have trauma, it's not that you will have a trigger, but you could be triggered, and know that that's not unusual, and that you can talk to someone about it, and they'll be able to help you process what happened and why it happened, and get you kind of put back together. Because I think one of the reasons that we see some postpartum depression also and anxiety is unaddressed trauma,
mhm,
or
mhm,
even trauma that has been addressed, but it gets triggered from
mhm.
this process that's supposed to be a wonderful, beautiful process. But if you've had trauma, it can be stressful.
Sure. Yes. Right.
Mhm, mhm.
Okay. So, yeah, so let's move into, so, for some, I think that you shared a statistic once where the majority of people tend to get back on track, like 3 to 5 months down the road after a baby is born. Is it about 70% or 80%?
Yeah, it's something like, let's see, that's another number I wrote down. I did, because I want to know. Yeah, but like really, it's 90% are having intercourse. That's the measure, right? Are having intercourse by 1 year postpartum. The frequency may have gone down,
Mhm.
so a couple that was maybe having sex 3 times a week. Now they're down to once a week, sometimes every other week, something like that. But just because you're having sex doesn't mean that you're problem free,
Mhm.
not home
Mhm.
free, that women are having problems, maybe having orgasm, problems with low desire that we've talked about already, body image issues,
Mhm.
Sometimes there's can be ongoing irritation of the labia, the tissues, and so on.
Mhm.
So UTIs as well. So there are all these things going on that contribute to a decrease in frequency. And of course, lack of sleep, fatigue,
Right, the things we kind of expect, right? Like babies
right?
take a lot of energy and stress, and it can also be different depending on whether or not you are going back to work, fairly quickly after having a baby or not. I mean, there's pros and cons to both,
Oh, yeah.
sometimes moms can be really excited to stay at home with their kids and feel like that's, their what they want, how they want to deal with that responsibility. And yet we also know that stay-at-home moms, struggle with isolation, struggle with, have higher rates of depression in some studies. Working moms, they're struggling to balance a lot of stuff.
Oh, yeah.
So it's just but maybe they're glad to be back at work and have a little bit of break. Maybe they're guilty about that. There's just
Yes,
so
yes,
many
right. I
complications.
know it's very complicated. It's very
Mhm.
complicated. And really, I think, honestly, just a commentary on our society in general that really moms and families could use more support in terms of, having adequate childcare, having low cost or free childcare. I mean, European countries do this. Why can't we have that here? They have much longer maternity leave, paternity leave. Dads are home and they really get to make a family, have a family feeling and a family bond that I think
Mhm.
is much healthier than what we do here. Here it's like pulling yourself up by your bootstraps and figure it out. And
Mhm.
it's hard.
Mhm.
It's hard to balance
Mhm.
everything. Mhm.
Yeah. Let's talk a little bit about the psychology of, so I'm talking about all the problems first, then we'll talk about what maybe we can do about them. But
Yes,
how
right.
about
Yes.
psychological? Yes. Just so psychologically, I think that for some women, this role of being sensual or sexy or a sexual person is not necessarily completely aligned with being a mommy and a, nice, innocent, lovely, I don't know if we call this the Madonna whore
Yeah,
complex, right? Or
right.
whatever, but it's kind of like the imagery we have around mothers is fairly asexual. And this,
Oh, yeah.
the image that we have around, sexual vixens or sensual seductresses is those energies don't really combine very well.
Unless you live where I do in Orange County, California, and then you can be a MILF.
And then you can be a MILF, then it's allowed.
Yeah, you're gonna be a
Okay,
total MILF. Like, if you're not a MILF, everybody's looking at you going, "Oh,
what's wrong
that's
with you?
she went to the dogs." Um,
Yeah,
but
which is
all
which is
joking
its
aside,
own pressure, right?
that's
So
it.
it's
Really, very
kinda
much
like
so. Oh yeah, I can kind of remember telling my mother, my own mother, when we moved down here from LA, and I saw the moms, dressed up to go pick their kids up from school. They're wearing eye makeup and like tight pants, and I'm like, what? I'm showing up in sweats. I went, what? I thought I was. Aren't I a mom? Like, what? I thought, well, I have to up my game a little bit. So I bought jeans instead of
that.
sweats. Like, anyway, but you're right. There can be this love lust kind of split that goes on. I think it's hard sometimes for women to connect with their own sexuality. It's like, wait a minute, it's confusing. Like, oh, I'm a mom, but I still have to be sexual? What? I have to split my energy. That's a lot for me, and I think some men as well also struggle. They look at their look at this their wife and go like, "Oh my God, she's breastfeeding, and she's got her tummy is stretched out, and she's not my spelt trim wife." I mean, we can really go on with the stereotypes here, can't
Mhm,
we?
mhm, mhm.
But something. I think it's not necessarily something conscious that happens. I think a lot of things are getting activated psychologically. Our template, archetypes, and templates of what we think where is supposed to be happening or how it's going to be. I mean, I don't know. if you think of yourself as you're going to be a mother who's wearing like a beautiful gown while you're holding your beautiful baby and holding it to your lovely breast, or you're going to be somebody with like burp up pads on both shoulders. So, right. And what your partner thinks is going to be happening as well. And when there's a disconnect there, I think it's hard to cope with that.
Yeah.
And it's hard to talk about because we
Mhm.
don't do a good job talking about sexuality, talking openly about gender roles and expectations, all of that.
Right. Right. And isn't it the case too that this can be a time when there's a higher risk of infidelity and betrayal in that regard?
Oh, yes, yes. Yeah, it's during the pregnancy. I didn't see any statistics about the first year postpartum, but that's why I kind of don't want to comment on that. But it is true that partnerships are at risk for infidelity during the pregnancy, which was surprising to me and yet not surprising. You
Mhm.
have women who maybe don't feel well during the pregnancy, are distracted. Some
Mhm.
women turn inward during the pregnancy, they kind of focus on their body and the experience of becoming a mother, sensation, bodily sensation, all of that. And so, and they're getting attention. And sometimes the guy doesn't know what to do. He doesn't know what the heck to do with himself, feels left out, feels maybe jealous, confusion. Couple doesn't talk about what's going on. And so, he goes and has an affair. And I've had, I don't want to say it's a large number of women, but it's a significant number of women who have either called me within a few months after giving birth, or maybe in speaking with them and going through the history, tell me what happened during the pregnancy. And then you see them both, you see the couple and like one, and like they both kind of like roll their eyes and they kind of pull away from each other and go like, he had an affair during the pregnancy. At which point I say, that's not the unusual. And there's such relief
Mhm.
when they hear that, because they of course think that they're the only ones
Mhm.
that
Mhm.
this has ever happened to. And
Yeah.
I mean, some couples survive this and some couples do not.
Yeah.
Mhm.
Well,
Yeah.
and I think they're surprised because, again, of all those stereotypes. You think about baby making time as a time when you're super close and feeling super connected, and we're starting this family, or we're going to have more babies and add it to the family. And yet, that stereotype, I think, ignores a lot of what you're saying, the stressors, the fact that the dynamics are really changing, right?
Oh
So
yeah.
where you once spent all this, especially if it's your first child, where you once spent all this time and energy together, or in certain gender roles, now it's very different. And that's a complaint I hear oftentimes from heterosexual males is, I feel replaced by the kid.
Oh
I
yeah.
don't matter, I'm not involved. And sometimes it takes a little longer for some males to bond with the baby.
Oh
Typically, I
yeah.
think I've seen some research where males tend to bond more in the toddler years, where the baby becomes more active and can interact, whereas the female partner oftentimes is bonding with the baby in utero, right? So she can
Right.
feel the baby moving, she can feel things changing and shifting, and so it's a very different lived experience, just from the fact that one
Absolutely.
body carries the baby and one body does not.
Right, right. That is so true. And that can happen, with lesbian couples as well, where one woman is carrying the baby and one is not. And, the one carrying the baby is getting attention from the doctors and, friends and family and so on. And the other one is feeling left out.
Mhm.
So that can cause an emotional rift in their relationship as well.
Yes. Yes. Yeah. And then there's this complaint that I hear a lot of times where the person who maybe is complaining about, hey, what about me? Oftentimes is met with, you're so shallow or selfish, or, like, can't you see,
Immature.
can't you see what I'm trying to do over here?
Right? It's like I have two babies. 3 babies.
Right, right. And I could really relate with both sides of that, equation because I was in a moment where I was like, am I just a cow? Everybody just wants me either for milk or boobs or something, everybody just wants to use my body. And then there were other times when I was like, yeah, I'm probably not as attentive. I'm probably not as invested. I'm probably not really, prioritizing my relationship maybe the way I should
Oh,
be.
yeah.
So it's,
Yeah.
it's a
I
hard
It's
balance.
hard. It's hard to learn how to balance it. Really
Mhm.
is. It takes a lot of work and listening, really deeply listening to what your partner is saying and from both sides, right? And for partners to understand each other's experience,
Mhm.
right? If we can understand each other, that's half the win,
Yes. You can have empathy for the other side.
right? And then and in fact, that is one of the things that one researcher said is that couples that are adaptive, the couples that are able to problem solve as things are coming up and figure out solutions and go through these transitions together, communicating with one another, say, like delegating to each other, figuring things out together, they do better than
Yes.
couples that either don't talk about what's going on and just hold that resentment in, or the couples that have a lot of friction and are openly fighting with one another.
Yes.
So, mhm.
Well, and like you mentioned at the beginning, oftentimes when I see a couple for sex therapy and they're coming in 10, 15 years after their first child was born, they're kind of way past the baby making phase. But as I ask those timeline questions, like when did the when did the train go off the rails, or when did things shift? And they start, not always are couples aware, because again, it's such a busy time and you're so, and you're usually, I mean, when are people having babies? Like mid-20s to mid-30s, right? About there. And that's a time that's stressful for family, for jobs. You're trying to get yourself ahead in your career. You're maybe you maybe moved a few times. Lots of things are happening. And sometimes people just they don't have that aha moment. They don't know that it went off the rails when they
Right,
had kids. So
right.
it's in asking those questions, that they're like, oh,
Yeah, right,
oh,
right,
maybe.
right.
And
Oh,
some people
yeah.
do know, some people know very well that that's exactly what had happened. But anyway, so that's, I think, a suggestion I would give to listeners is just think back, to when those moments were, and ask yourself some questions. How did we handle that? What was our sex life before having kids? What's it like after kids? And what was our journey? And hopefully you can blame a lot of what we've been talking about, which is the system that didn't prepare you, the system that didn't educate you, the system that didn't role model, the doctors that didn't really talk about anything other than just the vagina and the penis and their relationship with each other. And so that you can be, you can have some, I guess, some self-grace for each other. Like, boy, we probably did the best we could, but yeah, there's probably some things we could address now, right?
Right,
Yeah.
right, and clear some things up. Yeah.
Yeah. Yeah.
Mhm.
But for those that are still in the mix and maybe could listen to us, what are some of the suggestions? What are some of the things that couples can do to, head off some of these? Because we've talked about there's physical issues, right? So physical
Right,
pain, physical discomfort, hormonal issues that are driving,
right,
both your mood and your estrogen and all that. There's psychological issues, right? So your ideas about what it means to be a mom or what it means to be a dad, and do I have the right to be sexy? Do I want to be sexy or not? And then you have social issues, right? With parents and friends and culture telling you 500 ways that you're doing it right or wrong.
why
Usually,
do we ever have children, Natasha? It's so complicated.
what's a couple to do?
Right? And yet, I know you have your kiddos, I have my kid. I wouldn't trade the experience of raising my daughter for anything.
Yes.
So,
Yeah.
for me, all of those early years and the teenage years too, they turned out to be quite worth it.
Yeah.
So, but as far as what to do, I think, from listening to us, I think one thing is to just have a realistic idea. Not, you don't have to be pessimistic and go like, oh my God, listen to all the things, but to say, you know what, at least if things don't go the way I hoped or we hoped or imagined, that we can say, oh, you know what? Yeah, this is something that I heard could happen and we can do something about it. Right? To do some problem solving. Oh, be proactive. I'll make an appointment with the doctor. Or sex is painful. You know what? We're going to have to, maybe this is for the first time, we're going to order or get a bottle of lube or whatever. And do some thinking about the fact that couples that talk things out and problem solve together seem to do better. So
Mhm.
that would be one thing. Be prepared. Second is to do that problem solving. And problem solving is one thing that I realized in watching so many couples over the years, that if you're still bickering about what to do, it's because you haven't generated enough solutions. You
Mhm.
have to keep generating solutions until you come up with something that is workable. It's
Mm.
not about, it's not about what does stupid Dr. Phil say, the hill you want to die on. It isn't about that. It is right. It is about, keep generating solutions. Don't give up and work together as a team to figure out sexual solutions as well. My friend and colleague Barry McCarthy talks about being a sexual team, which,
Mm.
I think for women is like, but for men really like that idea. We're a sexual team. And, that gets a couple engaged in a certain way, like, okay, we're engaged with each other and we're on the same team and we're trying to work things out so that's pleasurable and satisfying for both of us most of the time.
Mhm.
Right? So it's not that like every time you have sex, you're hitting the ball out of the park. It's that, you're going for a good experience.
Mhm.
Right. So that would be very important. And I think, you and I keep alluding to, get creative, like outside the bedroom, doing things for each other, giving each other little touches. Sometimes I think I've suggested to couples, even if you can't have sex for some reason, you're tired or things are just too busy. If you told your partner, you know what, I know that this isn't a good time, but I want you to know that I'm thinking about having sex with you. Right? Like, that would be a nice thing to say. Like, you don't have to do anything about it, but I just want you to know I'm thinking about it. That can be a way of connecting sexually and saying, so couples have different things. Some couples like to text, some others like to do like say naughty little things to each other. Just, kind of staying lightly connected in that way. It doesn't all have to be sexual, it can be affection, goes a
Mhm.
long way as well. And like asking, I could think like, what if the male partner who felt left out was able to come to his female partner and say, I really, you know what, I feel left out. I really I need a hug. I need a hug. You know, I think most women would say, oh, okay, yeah, you're feeling kind of down and sad. I'll give you a hug, sure. So, right? And talking openly about the joys as well as the frustrations that come along with this period. And I
Mhm.
think also knowing that there is help, there's help, there's psychological help, there's help for the hormonal things that are happening, there's pelvic floor PT to help with some of these other issues, being patient, like the 6 week thing is like, I mean, I think most gynecologists at this point, I hope, are saying things like, I'm saying 6 weeks, that's when you could have intercourse. It doesn't, it's not a prescription for intercourse. Doesn't mean you have to start having it then, you talk with each other and figure out when you're both ready.
Right.
And Yeah.
Well, I love the suggestion for non-sexual affection, because a lot of times, especially if there's one partner that's really hesitant to have any type of sexual activity, they'll just withdraw altogether because, oh, if
Yeah.
I touch you, that might mean you might think I want to have sex. And so I won't even come close to you. And there's so much connection that we can get just from body touch, foot rubs, back massages, cuddling, holding hands,
Right. Take
checks
a
on the
bath.
cheek, taking a bath together. Yeah, taking a shower together. Just that skin to skin contact that doesn't have to turn into sexual activity can be really helpful. And then having a lot of other things that you can do that require less energy, sometimes it can be helpful to just say, you know what, thanks for initiating. I love that you still love me. Can you just, rub one off while you're lying next to me? That would be great.
Right.
I'm going to fall asleep in the process.
Right.
I love you.
Right. Right.
That's a creative
Right.
approach.
Right. Yes. Right. I'll whisper sweet nothings in your ear. But that's about all I can muster.
That's all I got. But I'm
That's
here.
all you're getting.
I'm present.
Right. I'm here.
And for both, to be okay with these kinds of creative solutions. And anyway, so I think that's really good. Really good stuff. So realistic expectations, solution focused types of ideas, get professional help if you need it, especially if there's anything painful going on.
Yes.
Sure.
Yes.
Don't just assume that sex is supposed to hurt after pregnancy and go untreated for something that might need to be looked at. And give yourself some permission to think outside of the box.
Yes. Yes.
And to be patient with one another, right? So I think those are all really, really great things. Is there anything that I didn't hit on that you were hoping to, make sure
you know what? I do have one thing that we didn't talk too much about, and that's body image. Oh my goodness. Women, please be gentle with yourself. Your body has gone through, it's really a trauma. I think of it as a trauma. Don't beat yourself up. Oh, look at this, look at that. Focus on what your body has done, or focus on things about your body that you still like. You have a beautiful smile, you're known for your eyes, you have great whatever, you have beautiful hands. Focus on those things. Don't get too hung up on your body image.
Yeah, that's a really hard one. Plus, there's certain things that don't necessarily go back, even if you do lose all the weight. Your hips kind of shift in ways that sometimes you can weigh the same and not fit into the same pair of pants, right? Or
right.
My feet never went back to the same size.
I know. What?
I had to resize my wedding rings, and there was
right.
things that don't necessarily go exactly back, but that doesn't mean that you can't feel attractive and sensual. And I think too, partners struggle with body image. There's some partners, male and female, that love the pregnant body and love, the whole thing, and are very affirming. And then there's partners that are, quite frankly, very shaming. And okay, when are we going to get back into, into shape? And so just being very mindful about how you treat your partner's body. And if you're having issues with attraction or things of that nature, go talk to somebody about that, because that a lot of that comes from this cultural narrative that we have.
Absolutely.
Yes.
Yeah. So, be proud, have pride, mom pride, dad pride.
Yeah. Those stretch marks, they symbolize something pretty amazing that's happened in your life. So
absolutely.
Well, thank you so much. Yeah, your time is just always just super valuable, super pleasant, super fun. Is there anything that, give us your websites and where can people find you or contact you?
So for my practice, that's thebeulerinstitute.com. for continuing education. That's learnsextherapy.com. And to find the books, just go to Amazon. You can just put my name, Beuhler, Stephanie, and my books will come up, and you can see what I've written and hopefully enjoy reading them.
Yeah, she does a great job. Well, thank you, Stephanie, for joining me tonight.
Thank you, Natasha.
Appreciate it.
Thank you. Thank you so much.
Teaching together this coming weekend. So
I know, right? I'll see you in a couple of days.
Wonderful. Have a great evening.
Okay, you too.
Best of
Take
care.
care. Bye-bye.
There is a place where time slows to nature's pace, and there is space there to find yourself in her embrace. Some places should be left alone. No tishki say the no, so we can always go to the homeland of the heart. Of our human history etched on her canyon walls, alongside Earth's mysteries. Some places should be left alone. No tishki say the novel, so we can to the homeland of the heart, to the homeland of the heart. Deep in our cities, we sleep without her stars, yet still her presence sustains us from afar. Some places should be left alone. No tishki say the novel, so we can always go to the homeland of the heart, to the homeland of the heart, to the homeland